What is the term for air present in the pleural cavity? So this pleural cavity is referring to this part of the lung, this area where there's space between the lung and then the outside of it. So you have this lung here, and then this border space that's surrounding the lung is the pleural cavity. And usually in this little gap that's between the lung and the outside of the cavity, it usually has some fluid that just protects the lung itself, and this is called pleural fluid. So this would be pleural fluid there. And there normally should not be any air in this space. If there's a condition known as a collapsed lung, which you might have seen it nicknamed as, that would mean that there would be some air that got in, or in some cases, depending on the type, it could be blood or something else that should not be in that space, and it would cause the lung to literally collapse into that space and get smaller because it's filled with air or fluid or something else that should not be in that section of the pleural cavity. And this condition, collapsed lung, is a nickname for a condition known as a pneumothorax. So pneumothorax. And your pneumothorax could be different types. You could have a tension pneumothorax, a spontaneous pneumothorax, meaning that it just happens on its own. Some people are prone to them, or it could be from trauma. There's also something known as a hemopneumothorax, which means that there's blood in the space. So based on the choices for this question, when it's asking, which is the term for air present in the pleural cavity, we know that a collapsed lung is a pneumothorax, and pneumothorax is an option here, option A. The other terms have different meanings related to the lung. So pneumonia would be some sort of consolidation or some sort of infection, a foreign substance in the lung itself, which is different from the actual collapsed pneumothorax. It's a different type of lung disease. So we know that this is a lung disease. Option C, pneumonitis. We know that itis is inflammation, and a pneum has to do with the lung. So this is just a general term for inflammation of the lung. And then option D, pneumoconiosis. This is a lung disease that has to do with inhaling dust. So related to dust. So different than the pathophysiology of a pneumothorax, which we would see identified in this image here. So option A, pneumothorax, would be correct for this question.